Guys, Dr. Michelle here in the cozy clinic with the nice lighting. Hopefully you can see me. I just got done with patients and we were talking about hot and cold, when to use it. So I like to suggest using cold with acute injuries immediately. If you have a trauma, a fall, icing the area up and elevating above the heart. Really have to get it up there for it to make a difference with circulation. But icing, I usually recommend about 48 to 72 hours. And then I'm recommending heat to circulate and move the blood flow to the area to continue healing. I also recommend getting acupuncture and moxibustion therapy and all the therapies we can do as Oriental medicine practitioners. I treat a lot of traumas and falls, including myself. So head over and watch some of my lives. You'll see some of my fractured toes, and some of my live videos expressing that. But back to the hot and cold. So 48 to 72 hours, generally speaking. Now, if it is a nerve condition, cold is usually very good because that helps the inflammation of nerves. If it's muscle, definitely heat. If it's a trauma, I'm usually recommending 48 to 72 hours and then moving into heat. Something that I wanted to share around the heat is in Chinese medicine, we've used a lot of moist heat in our therapies. Moist heat is more nourishing than dry heat. It's going to help nourish the tendons, muscles, and bones. Especially as we age, we start to dry up, wither away. Our bones, muscles, everything starts to dry, just like, dry hair, brittle nails, all of that. So it's really good to nourish the area with moist heat. I don't ever recommend falling asleep with heat, but one way to, well, actually two ways to get moist heat if you don't have a hydroculator like I use in the clinic, which is a device or a kind of an encased that holds hot packs. They have to stay moist at all times, and then it heats up electrically. You plug it in. But if you don't have a hydroculator, two great ways for home therapy to create moist heat. One is, I know that they have heating pads, I think now with the inserts that you can buy, where you can moisten the little insert and then put that inside the the heating pad, and then place that over the area. So that would be one way. Another homemade way to make moist heat is to take a hand towel, wet the hand towel, place it over the area that you're going to be treating. So let's just say, for instance, your knee. So you'll be placing the moist hand towel over the knee and leg area. And then you take a piece of saran wrap and then put your heating pad on there. Now, another great therapy to add in that is to add in essential oils. If you want to know recommendations for that, please make a consult, because essential oils therapy, both internally and externally, can be wonderful. I talk about treating my neuropathy with some essential oils and Chinese herbal medicines. So plant medicine is amazing for treating trauma and injuries. So you can also schedule an herbal consult, but consider using whatever tinctures you like. If you want to start using essential oil therapy, I can help you with that. And then you would apply a thin layer, a few drops if you're using the oils that I prescribe, or a little dab will do you with the company that I use, because they are certified pure. And then you could then proceed on with the moist hand towel, the saran wrap, so your heating pad does not get mucked up, and then put the heating pad on. Again, please do not fall asleep with the heating pad on. Sometimes people have decreased sensation or neuropathy, which can create kind of a numbness and decreased sensation, and you could get, first degree, second degree burns. I have burned myself with heat methods. So please be careful with that. Let's see, heating, another thing that you can do after you've kind of left the icing phase, um, and you're treating trauma injuries, is you could even alternate with ice and cold and heat, if that's something that feels good to you and that's calling to you. I, again, typically recommend moving into heat after 72 hours of a trauma, injury, fall type condition. So I hope that that helps you. I really, have been educating my patients around when to use hot and cold, and I use it in my clinic daily. So please remember to subscribe, hit the like button, tap the bell a couple times so you'll be notified when my daily, weekly videos come out. And Princess Annabelle and I will have more to come. So stay tuned, and we thank everybody who's new to subscribing on our channel. And then we also thank all of our OGs, our our young goodies that have been around supporting our channel. So if you have any questions or comments about heating and cold therapy, please put it in the comments or email me at michelle@designtoheal.biz. If you'd like to do a consult, reach out to me, and we can set that up via telemedicine, online, Zoom, phone call, or live if you're in the area. So thanks for watching, and I'm wishing you many, many healthy blessings of wellness, mentally, spiritually, emotionally, physically. So remember to fill up your tank, take good care of yourself. Okay, see ya.